I would say that the question of how much to support and when to consider dose reduction really needs to be individualized. It has to do with the patient's tolerance or appetite for dealing with side effects versus wanting to be on the full dose. Some patients care greatly about being on the most they can possibly tolerate. Others really are eager to minimize their treatment-related side effects and have it be as minimally symptomatic as possible. I always want to bear in mind and emphasize to the patient that this is meant to be a longitudinal therapy that we hope for them to be on for a very long time. So it needs to be sustainable in terms of the side effect profile and tolerability. Many patients come to know how to manage the diarrhea that they sometimes experience just with dietary changes, or they'll take antidiarrheal medicines. They can manage the skin side effects that often do come to abate a bit over time. Just really knowing how to handle them seems to make a lot of patients do well. I think it's very important to know that I, as the physician, am available and my nursing staff are available to talk with them and help them work through side effects, figure out if they need to see me before an otherwise scheduled visit. But I do follow patients particularly closely in the first few weeks because there's so much variability in the tolerability of these therapies. Some patients really have greater issues with rash or diarrhea or sometimes other ones than others. And so I typically see patients at 2 and 4 weeks after, largely to go over the side effect profile and work through any adjustments that we need to make. And my support staff of nurses are available in between, as am I if needed.